Well, hello. You can tell it's me alone, Michelle. Welcome to the Nutrimedical Report, and when Bill gets back, he'll welcome you as well. In the interim period, I have something to say. This morning I talked with Denny up in Oregon, and we were talking about how much we love the life support and the ageless. Hi, Bill.
Hi.
Nice of you to show up. And his daughter, 12-year-old daughter, doesn't take, she eats poorly, right? White bread and blah, like a lot of the kids nowadays. And even when we were younger, hey, Bill, we ate a lot of white bread and stuff like that. But anyways, he couldn't get her to eat properly. But she loves the life support and takes it every day and feels great afterward. I don't want to go into details about her health condition. It's kind of a private thing. And Denny, I know if you're listening, I know you'll talk to Dr. Bill about that, but she has some other issues. And the life support is the drink for young people.
We have basically...
And me.
I often use a combination. The one I give myself and Kelsey is a combination of all four drinks. I have the Life Support Ageless, Nutri-Complete, and Glycemix.
Yeah.
And then I may throw some other things in there. But you just have the drinks alone, you're going to be way ahead of the game.
Yeah, and most people are on a budget. You've heard me say that before. I'm going to say it again. And when you buy a great big 2-pound canister of the Life Support, it'll last you at least a month. Hey, Bill?
Yeah.
And mine lasts longer than that because I just take one scoop of the Life Support and one of the Ageless, and I throw in a Glycemix now. Over the past couple of years, I think I've been doing the Glycemix.
Right.
And true, I think they're $79.95 for a canister, unless it's on when it's on sale. It's $74 plus free shipping.
Right.
So enjoy that because life support has so much in it, Bill. I mean, honestly, I don't wake up unless I have my drinks in the morning.
Yeah, I've got to make a comment here. I just had an email that came through that you sent to me. From one of our gentlemen.
Oh, I looked it up. I'm reading. I see what you're talking about from Cecil in Texas.
Yeah. And there's a lot of people that are they're becoming Google geniuses. They think they can find products they think they can find, and I'm a little angry about this.
Yeah,
Stop trying to second guess Dr. DEAGLE. Stop trying to think you're going to get products that sound like they're equivalent. Stop doing it.
Well, guess what, Bill?
Because
I looked it up to see where it was.
What is it?
It's over on InfoWars.
Oh, no.
It's another one of Mr.
Alex Jones, idiot.
I don't want to say his name. It's not even...
Alex Jones, idiot. Okay, this idiot
anyways,
that pretends to be a functional medicine expert. Oh, yeah, I see.
Yeah.
Oh, no.
So anyways, and then I looked at the ingredients. Anyways, poor Cecil, my dear, let Daddy B, let Bill over here do the research for you. And he's the expert. The rest of us get to... Well, like Danny said. Danny, you know what Danny and I said today?
Yeah.
On the phone?
What?
We're very thankful. He's a very strong Christian, and I like to think I am too, and we're very thankful for you.
Right. Now, I said something.
Why.
I have to say something important.
Let me
go
say
ahead.
why first.
Mm-hmm.
Yeah. Because you bring to us all that knowledge that God gives you, and you bring to us all that knowledge. And yeah, you're right. When someone else is saying, well, let me see, here or there or whatever, you don't have to go here and there because you've done all the work for us.
Well, I'm going to add something to that you'll be surprised at.
Okay, what?
In general, whether it's geopolitical or other issues, most of the time I know 10% of the topic, but when I pray or when someone asks me a question on air, God gives me instant inspiration to give a correct answer and a solution to any problem on earth. And I've said this, and I challenge people, it doesn't matter if it's a geopolitical, medical, metallurgical, or issue dealing with the climate change, I can give them a solution, and it doesn't come from me, it comes from God. Now, in the health issue, it's probably 25 to 50% of my knowledge over 4 decades. But half of the time, plus to 3/4 of the time, God is giving me inspiration. He tells me where to do my researches, how to connect with people, what some scientific facts. For example, the NutriSilver, it was literally prayer for several years before I found the right scientist to upgrade and create the NutriSilver technology, which is even more advanced than Silver 100. So people need to understand it's not just my medical knowledge, it's this supernatural gift that God's given me to bless people, to give them this information.
Amen.
Yeah.
Amen. Thanks, Bill.
Yeah, I just wanted to mention that. So in other words, not just me.
I was trying to spend a moment to thank you.
Well, thank you.
And Denny wants to thank you. And I bet you there's a lot of listeners out there that are sitting there thinking, I'm so thankful that I have Dr. Bill. And guess what? Once you're a member of the Nutrimedical family, because that's what we are, you can call anytime and Bill will talk to you.
And please, Stop listening to these yahoos that want to co-market against our products. They don't know what they're doing. They're fools and they're liars. Okay, please.
Well, Bill, this week I also spoke with Corrine. She is a biochemist, Bill.
Uh-huh.
And she lives in Arizona. But she was born with mitral valve prolapse and syndrome.
Right.
Okay? And she's a listener.
Right.
And what do I say? Anyways, she discovered, with her biochemistry and everything,
right,
she discovered that by taking the Calm Mind and Brain Mag together, that it takes care of her mitral valve problem. By taking Calm Mind and Brain Mag. I know it's a hard thing, but she says that that's taking care of her mitral valve.
Well, I'll tell you part of the reason for it.
What?
There are specific autonomic nuclei that control the valve leaflets and also control the driving pressure of the heart. Mm-hmm. Most people don't realize that hypertension is the body's, if you want to call it overall, and also the cardiac contraction of the heart and the resistance of the blood vessels and so on. Because the way the circulation works is this. Your heart pumps out, and about 25% of the blood flow to your tissues comes from your heart. Mm-hmm. 70% comes from the blood vessels. And if your valves are dealing with the resistance, and I usually tell people if they've got mitral valve prolapse, what they need to take also is our Copper Regenamax and Minerals Plus and Collagen Max. And the reason is that the valve leaflets lack elastin production in the blood vessel walls, mm-hmm. so they prolapse more easily. There may be anatomic factors, but there's also structural factors in the strength of the valves. Also, a lot of time with mitral valve disease, you can end up with calcification, which you can reverse with the full vitamin K2. Then you can also monitor it with a high-speed CT scan for calcium score. So when she's talking about the Calm Mind Brain Mag, what's in them, and I'll explain this, is magnesium L-threonate and magnesium glycinate malate in the Brain Mag. And they did studies on knockout mice where they actually get Alzheimer's disease or neurodegeneration like acute macular changes and so on. And the knockout mice live longer than the normal mice because of the Brain Mag. Now, your autonomic nervous system, which regulates the carotid body in your neck for your blood pressure, and the autonomic nervous system is downregulated by Calm Mind and Brain Mag. Mm-hmm. The Calm Mind has xanthine and L-theanine, which is a B vitamin. It has myoinositol B vitamin. It's xanthine that calms your central nervous system, and it has GABA, which is a postsynaptic inhibitor. So when there's sympathetic overactivity, that's when the valve leaflets can prolapse. The reason why it's helping is it's stopping sympathetic drive or surges that will cause valve prolapse.
She said that 2% of people have that syndrome.
Yeah, it's very common.
Yeah.
Yeah, and now 25% have an ostium secundum valve flap between the right and left atrium, where if they have a clot in their legs, they can throw it up and it'll shoot across from their right atrium to left and go to their brain. Mm. So I tell people, if you've had any kind of clots at all or varicose veins, you should get a transthoracic ultrasound to see if you've got an ostium secundum flap, and then start on something like our Cardiovasc to reduce clots and nattokinase. But don't go take Coumadin, Xarelto, or Eliquis.
I also talked with Kathleen, Bill, from Arizona. When she was 6 months pregnant, unfortunately her baby was born, her daughter.
Right.
And she was only 2 pounds. And they did that. Remember we talked the other week about the oxygen and damaging the eyes? Well,
right.
Now her daughter is 50 years old, and of course she's very little vision, 10% in one eye. She said she had German measles too when she was pregnant. So she's wondering, I guess it's the oxygen that caused the...
You can increase the fibroblasts in the back of the eye. What I do there is I use a series of peptides, hyperbaric oxygen, stem cell therapy for reversing that. Mm-hmm. So it won't be a total reversal, but I can reverse a lot. And we can reverse the retinopathy, which is a fibroblast retinopathy. Mm-hmm. So I use peptides, stem cell therapy, and hyperbaric oxygen therapy, along with our other nutrients to support eye regeneration. So That's available already right now.
So is there anything else you'd like to say before we get into the emails? Because I have so many.
I'm really happy about, I did put out a note today. We do have the NutriSilver, mm-hmm. which we
should be talking about that NutriSilver.
Yeah. I'm going to explain the technology. It's angstrom molecular.
Want some of my water?
Sure. It's angstrom molecular silver, which is even better than the silver citrate in silver 100, but just hundreds of times stronger than the other silver. but it is hydrogenated to make it alkaline to get it across the cell membranes and the ion channels. But I wrap it in a liposomal enzymatic envelope to get it to the target tissues.
And you can put it directly in your eyes.
You can put it in your eyes, your skin, to stop sunburn or burns, to clear out your bowels. It's amazingly powerful. It's amazing. It's amazing. And then we have also our transdermal creams. We have a new supplier for our DHA, pregnenolone, and progesterone.
Oh, that's what I wanted to talk about today. Yes. Now we have the DHEA, the pregnenolone, and the progesterone.
And by the way, the little pump needs 4 pumps to go into the old 1 pump. The old 1 pump with the older style device, which we have a few left of the DHEA and femgestrone, and when the new ones now are 4 little pumps. But I really like these newer devices. They're great.
Okay, and why would you say for menopause? What would you do?
DHEA, pregnenolone, and femgestrone. I also put a notice out that some people may benefit from us giving estrogen, although your body will make it with the DHEA and pregnenolone and testosterone. But
okay, so if you're menopausal and you take the DHEA and the pregnenolone, your body will make its own estrogen.
Right, but we could add, as I say, we now have a good manufacturer that can make for us the estrogen and the testosterone too, but your body will make it. And the nice thing about making it...
What do you mean? Is that our progesterone?
Progesterone, the femgestrone cream is already made because that's more difficult for the body to make. But
now, what does it do? Okay, the DHEA
and pregnenolone will support your adrenal glands and your sex hormone production.
And what does the other one do? Progesterone.
That's for menopausal as well, especially or PMS. So if it's PMS, you can give them just the femgestrone. It'll stop a lot of the PMS symptoms, along with the hormone synergy.
But what specifically does it do that's different from the other two?
The body has more difficulty making the progesterone at the right dosages than the estrogen, which the body can make for quite some time after even menopause. The progesterone drops quicker in perimenopause.
And do you think most women that are menopausal or post-menopausal...
They should be on this. They should be on this. And then I put out the notice...
Otherwise, do they get hairy like men or something?
No, if we give them the hormone synergy, they won't. That's the danger
now
of even...
something else, the hormone synergy.
Yeah, the reason why it's really important, because if you give even injections or pills, like the older style pills or hormone injections for hormones, the excess hormone the body will convert to male hormone in females. And so they'll start getting hair or even balding in male pattern balding parts.
And what does the hormone synergy do?
Adrenaline blocks that conversion from female to male, and for men, from male hormone to female.
So it does it for both?
Right. Yeah, but I put the notice this morning that if you want us, and I want to get feedback, we can also supply with a little bit of the testosterone and estrogen, but it's really not necessary because their body will make what it needs. And the thing that's nice about ours, which is transdermal, is that you don't want excess, because if you get excess, for example, this is interesting to know, that most of the men that are getting testosterone, and there was a case that I heard recently that was actually quite funny in the news. This man was developing breast buds who went in to see his doctor up in L.A., and it turned out his levels of estrogen were higher than his daughter, who had just gone through menarche, started having periods. So because he was getting transdermal testosterone, and he didn't have our hormone synergy, and the transdermal testosterone, same thing happens with pellets or injections, and he actually was making enough female hormone in his adipose tissue, fat in his liver, that he actually had higher levels than his daughter. So he's getting breast buds. It's like he's going to soon have milk, as they say.
Let's get into the emails, Bill. We'll start with Erica and Tom from Lobethal, South Australia. Dear Michelle,
is that how it's pronounced?
I don't know.
Let me see if I can pronounce it, because the way you mumbled it, I want to see if I can make it sound Aussie.
Lobethal? Go ahead.
Yeah, you think you're probably close. It's not Lobethal. It's Lobethal. You have to put here an Aussie. Lobethal has to be strong.
Erica, you can email me and let me know if Bill's saying that right or not.
Lobethal.
He thinks he is. That's all that counts. Dear Michelle, we hope you remember us and that you and yours are doing well. The reason we have not been in contact for so long is that our house burnt down in a forest fire about 18 months ago. Oh, that's not good. As you can imagine, our life has not been much fun since then, and Tom's health has taken a very bad turn for the worse. He has this one, Bill, Ehlers-Danlos.
Ehlers-Danlos, which is a genetic disorder
so
of...
severe that he is bedridden.
It's a genetic disorder of elastin metabolism, and I can help it. We use the copper Regenemax.
It's a what? What is it?
It's a elastin genetic disorder of a gene SNP, and we support it with copper Regenemax, Minerals Plus, Collagen Max, and Her Majesty's Royal Jelly NutriMeds.
Are you going to put that in the wellness?
Yeah, I'll post that up.
Protocols?
I just had a response already to them.
Yeah.
But
we need
Ehlers-Danlos syndrome, and you can see an increase in the elastin production, which will help a lot with the valvular heart problems, and the muscular problems, and ligamentous subluxation problems.
Patrick from Ohio. Dr. DEAGLE, I just purchased NutriSilver spray and NutriSilver dropper. Can you tell me how to use this product to treat bed sores for the elderly? And can you tell me how to use this to treat any other infection like UTI and pneumonia?
Firstly, if you're trying to treat bed sores, you want to put a couple sprays, 2 or 3 sprays on the areas every 3 to 4 hours. Then I would cover the area with pregnenolone and curcumin cream. Just a little thin bit. You don't need to put a whole lot, slather it on. That'll stop the bed sores from deteriorating. You want to improve the microcirculation too, so I use things like the supernox nitric oxide in the cardiovasc to stop free radicals in the skin, and gamma E plus orally.
And UTI?
UTI, real simple. 3 drops or 1 spray per 10 to 20 pounds of body weight.
UTI?
Urinary tract infection.
Yeah.
And then I would use that 3 times a day. So probably 1 spray per 20 pounds body weight 3 times a day will do the trick orally.
And pneumonia?
Same thing. And you can inhale it. You do 3 sprays, hold it for a count of 10, and repeat.
Now, would you recommend for pneumonia just the NutriSilver, or would you add something to it? Or
NutriDefense. I'd add NutriDefense. And if it's real serious recurring pneumonia, I would probably add another antipathogenic like Nutriodine or Allicin Med. Well, at least 2 of the 3 if you have a serious infection that's recurring or that kind of thing.
Kathleen from Washington State. Dear Michelle, I was wondering if I could add the DHEA to this order. I heard back from Dr. Bill after I placed the order for menopause. Did you know that your kneecaps sweat? Yep, she says. That's menopause. Not fun. I just want a good night's sleep.
The hormone synergy will stop that. It's an autonomic thing, and the hormone synergy will stop the dysautonomia. So you take 2 capsules in the morning, and usually your hot sweating spells your kneecaps and heat issues go away.
Now, if she's talking about adding the DHEA to the order, don't you need the pregnenolone with it, or are you okay with just the DHEA?
You need both. Both.
Why?
Because if you don't have both, you can't make adrenal hormones or female hormones.
So you need the DHEA with the pregnenolone?
And pregnenolone, yeah.
Okay.
Yeah.
Nathan in an email. Dr. DEAGLE, do you have anything to treat and heal, what he calls... That's that Morgellons thing, but he calls it environmental toxicity. I have environmental toxicity, and I'd rather describe it as hypertoxic condition. I am dealing with so much at the moment, and goes on to say...
the Morgellons theory that they have is...
He says it's clogging his arteries in his brain.
Well, first off, he cannot have evidence of that unless he has advanced testing, which is not available to conventional or other so-called doctors.
Yeah.
Firstly, when people say they have Morgellons, they're often saying that they've got some kind of space pathogen from interstellar space. What Morgellons is almost certainly, this is my theory based on the research I've done, a thing called agrobacterium, which is an anaerobic bacteria in the soil. Soil bacteria. Yeah. It's been genetically altered by poisoning the soil and irradiating it. And now we have this mutant version of agrobacterium that's now infecting humans, and it can create strings.
Quickly, what would you recommend he take?
2 of our 3 antipathogenics, Nutriodine and NutriSilver, Allicin Med, and I would boost the immune system with NutriDefense.
Yeah.
Yeah, but it's a anaerobic, agrobacterium, that's in the soil that's infecting humans and it's acting to do weird strings and other things besides the regular bacteria. 701-801-2263.
And that's
and if you listen to that line, it's rebroadcasting the show 8 times a day on the phone. Now, there are also other numbers and ways of listening to the show on the internet. If you go to the Listen Live panel on the right-hand side of the front page of NutriMedical.com, also the call-in line to call into the show, except for the last hour on Fridays, is 800-313-2263.
Well, his question there, I'm reading it, Bill, on the computer says, or is it part of the regular RBN list?
No, everything is completely separate from RBN. When you go to Republic Broadcasting, you just get a link to our site. We are completely separate from the RBN audio files, etc. If you want to listen to the show, you can listen to nothing
so you go to
over there, except for the dial-in number to actually listen to the show while it's playing.
So what website do you go to?
Nutrimedical.com, NUTRIMedical.com. Everything is completely separate.
You got a good radio voice, Bill.
Yeah.
Medical.com.
There you go.
Let's see. Next is Tor, T-O-R, from Norway. Look at that place. You want something to pronounce for fun? You try pronouncing that.
Tor Olav Bradskorgard.
My name is Tor, and I'm 38 years old from Norway, and I've been listening to Dr. Bill DEAGLE for a while, and his knowledge about stuff is impressive. I'm sorry with the bad language. I usually write in Norwegian. I'll try to read this as best I can here, Bill.
Uh-huh.
I have arthritis and muscle fatigue. That's funny, M-U-S-S-E-L, Bill.
Right, that's funny. It is funny.
Anyways, and the doctors give me this one, Humira, Bill, and Simponi. Are you listening?
Yeah, I am.
Stop reading
I am.
the
No, it's
computer.
important. I'm trying to clear some stuff here.
But don't clear your computer when we're on the air on my show.
No, I was trying to see if there's any important
Stop that.
emails that have just come in, because
There's
sometimes
nothing
they
more
do.
important than what I'm saying right
Go
here.
ahead.
Look at how many I have today.
Just continue talking, please.
Look how many I have
I know,
today.
yeah.
Look, feel that.
Yeah, I don't
Usually
need
you
to.
say a
Please
fistful.
continue with their Tor.
Okay. Pay attention.
Wait.
Anyways, do you have something to recommend? Did you hear what it was? It's arthritis
Yeah,
and
those
muscle
drugs
fatigue.
are given only for autoimmune arthritis like rheumatoid or scleroderma or mixed connective tissue disease.
Yeah.
They're unnecessary. Firstly, most of the time they don't deal with inflammatory arthritis in a comprehensive way, and they actually are very toxic. You can start getting cancer and autoimmune and infections from even your pets from taking these disease-modifying drugs, and you can actually get cancers like hairy cell leukemia and weird stuff that normally doesn't
So
affect
these
humans.
drugs are prescribed in Norway and everywhere, all around the world. People are getting
Killing
poisoned
people and
with this
screwing them
stuff.
up, yeah.
Wow.
So what we do is I recommend, number one, you start off with Inflamex. You can also use seroflozyme, but Inflamex and Cell Defense Plus, the anti-inflammatories. For the joint regeneration, Collagen Max, Tendon Bender Joint Performance, and Mountain Red Velvet. You may also add Her Majesty's Royal Jelly, NutriMeds. And then to turn off the stealth pathogens, because rheumatoid is triggered by Mycoplasma hominis incognita, which is a mycoplasma that actually is in the joint space. It triggers off the immune homology, which is immune similarity to proteins in the synovial membrane, creating synovial granulomas that actually are called rheumatoid nodules. So what you do is you use our two or our three at least antipathogenics, NutriSilver, Nutridyne, Allicin Med, and NutriDefense. And then you want to turn off the free radicals in the joints and metabolic. Number one will stop and lower the cytokines, gamma E+, which is the gamma tocopherols, and things that modify the joint cytokines are Cell Defense Plus, and when you're trying to rebuild the joints, we talked already about Mountain Red Velvet, etc. So, and the most important thing to turn off the immune system is a ketogenic diet with malignant arrest, which is our protocol we use for cancer and autoimmune conditions. You can use a combination of you shut down what's called a hexose monophosphate shunt, because the anaerobic metabolism in autoimmune disease and cancer is identical in the early stages of both conditions. And you do not use these disease-modifying drugs. They will screw you up big time.
Yanni from Canada. Dear Dr. Bill, how are you, sir? I've heard about you at RBN. My name is Yanni, and I have problems with my health. I have had stents put in my heart, and they've put in a pacemaker. And besides this, I'm on dialysis. I would like to know if you can help me.
Well, first off, what is heart and vascular disease? It's infected biofilm. And the biofilm you kill off with NutriSilver, Allicin Med, Silver 100, the Nutridyne. The heart disease you reverse with Cardiovasc and Supernox, Gamma A+, CoQ10, Ubiquinol, and the Vascucare Carnitine, Omega Cod Liver Liquid, Omega Supreme, and Omega Supreme Krill. And you can turn all these off, and you can stop the calcification of the arteries with the full vitamin K2. You can open up your kidneys with the fat-soluble thiamine, ultrathymine B1, and Vein Away. You just need to get 25% function to 20%, and you'll be off. And Michelle, we're back, and we're answering questions. Go right ahead.
Tim from Missouri. The Uri International Feast I missed terribly. That was something we had like years and years ago. Remember, Bill?
How can you miss them when we have all our drinks that are better than Uri?
He probably hasn't listened for 1,000 years. Anyways, anything close that you can recommend?
First off, our drinks are far superior to Uri, which is the Ageless, Life Support, NutriComplete, and the Glycemic. So don't even think about Uri. This is far superior. Has activated bionutrients in it besides just the lyophilized drinks. These are far superior to anything else in the market. From Metagenics, Allergy Research Group, or anything out in the garbage networks like Alex Jones, Vitacost, or over at Amazon. Don't get garbage out from elsewhere. This is the best stuff. Ageless, Life Support, Glycemics, and NutriComplete.
It really is.
Yeah, there's no comparison.
Yeah. Anyways, if I was going to recommend to him, I would say the Life Support would be the complete one that would take care of everything. And then if you wanted to get something else, probably the NutriComplete, which I don't talk about too much. The NutriComplete is like getting all your vegetables and fruits. And if I remember correctly, the Uri used to be a vegetable fruit.
Let me hit the high points for each one. Life Support has all the Vega Pro protein. It has all the vitamins and minerals plus Vitamin Mineral Max. It has phase 2 detox for sulfation, glucuronidation, and methylation. Ageless has the DNA repair of the malignant block, has the Vega Pro protein, has the probiotics, has the things to lengthen your telomeres.
It also has immunoglobulins.
Immunoglobulins, yeah.
Then
the NutriComplete has all the best reds and greens of all the veggies. It has goji berry, the second most powerful antioxidant we have. And then the Glycemics actually blocks carbohydrate absorption even in meals hours later. Mm-hmm. It lowers blood insulin and glucagon levels and normalizes your blood sugar. So that's what's in each of these, and they're very, very unique, very superior in terms of most taste and flavor. And people basically, when they start them, they just get addicted. So don't even think about Uri or anything equivalent. Stop trying. If you're listening to the program and you're checking out the website, because we're now putting videos up on all of the products, don't waste your time trying to search elsewhere to find something equivalent. You're not going to find it.
And right now, I do believe I have Life Support on sale on the front page.
Right.
If you're interested.
Yeah.
Next is Mark from Texas. I am emailing regarding my father, who's 78, has been diagnosed with a 1.5 centimeter tear in his rotator cuff, which started hurting him around 3 weeks ago. The surgeon advised he can fix it with surgery. I'd like him to pursue other non-surgical options.
Well, first off, depending on the tear, what I'd recommend you do if you wanted to get a consult is that purchase a consult unit, send me the actual MRI scan, I'll tell you whether or not it needs to be repaired. If you do, you need to take nutraceuticals so it repairs quickly. You only get 50% of tensile strength of any connective tissue in the body at 1.5 years after surgical repair. So you may need both. But the thing is, if it's a very minor tear, like in-substance tear, it can be repaired with Collagen Max, Her Majesty's Royal Jelly, and of course the minerals that are present that help to speed that process in Vitamin Mineral Max, Minerals Plus. But I strongly recommend what you do is, if you're not certain and you want to get an opinion, is actually purchase a consult, send me the MRI scan, I'll look at it, and tell you whether or not the tear requires a surgical intervention. Don't just assume that you can just jump to taking nutraceuticals and it'll repair it. Otherwise, you may have to go back in 6 months and repeat the arthrogram under MRI scan and see if the tear is completely ruptured. That's not good, because if you get atrophy and so on and retraction, you're going to have a hell of a time repairing it.
Jeannie, in an email, I've been giving 2 drops in the morning and 1 drop at night to my dog. He's 10 to 20 pounds. That's how much her dog weighs.
Little dog, yeah.
And she's putting it in 3 ounces of water.
Well, the usual dosage for a child is 2 to 3 drops per 10 pounds body weight. So I would recommend using the dosage range. 2 to 3 drops a couple times a day is plenty for support of mitochondrial function.
What's wrong with the dog is a bad cough.
Okay, well then if you're trying to not treat thyroid but treating infections, you need like about 2 to 3 drops per 10 pounds body weight. So to 20 pounds, I'd give 6 drops 3 to 4 times a day. And you can also use NutriSilver. I'd recommend with the coffee, you probably use 2 antipathogenics like the NutriSilver spray and the Nutriodine would be my first choices there.
Have you said much on the air about the QRMA time purchase? Because
yes, I have. I mentioned it. I did mention that we have. Yes? Yeah, you can purchase the QRMA or the Metapathion time. And the thing is, all of the consults to analyze the QRMA data are free for you and your immediate family. That means your parents, your kids, your first cousins. I'll analyze. All you have to do is send me their history. But if you don't, and you go to a testing center, you got to purchase 2 units for a consultation and fill in the form because I have to have more information. But if you purchase the machine on time, you immediately get that benefit, and you have it for good for you and your family. Now, it doesn't include a full consult where we're reviewing medical records and labs and x-rays. That's a separate thing. But for the basic analysis of what supplements to take and so on, it's an amazing deal, and you can purchase over time. You have to talk to Michelle, and she'll arrange it for you. For both machines, the Metapathia and that. And if you want to be a testing site, we can actually instruct you how to become a testing site too.
The next question, Bill, is just the prayer. There's a few questions that are the same. There's one here on vaginal dryness. Didn't we cover that in the first? Were those DHEA and pregnenolone?
DHEA, pregnenolone, and progesterone, and the progesterone. You need all three. For
vaginal dryness?
Yeah, for dryness, because the body will make it. And if it doesn't do it, the next step is to give her topical transdermal estrogen, which, as I say, I talked on the air earlier in the first hour that's available. If people want me to start providing the topical transdermal estrogen or testosterone, we can do that too.
We have the next is the prayer of the 12 stones.
That's still posted.
A few questions on that. Where is the prayer of the 12 stones? Can you explain it again?
It's at the top of the Nutrimedical page, right up above the latest shows. For example, the show today, which will be posted up on the 4th, it's right above that. You'll see a breastplate of the high priest.
And you click on that?
Yeah, you click on that and you'll open it up, and you won't see the breastplate until you open up the PDF. If you do, you'll see all the stones there and what they mean. I'm
saying these kind of fast because look, I got to get through these today.
That's okay. Yep. You got 10 more minutes in this segment.
I'm just asking you the lower wisdom tooth removed. How to prevent infection after the wisdom tooth is removed? How to stop coughing on the air? Let me see.
Well,
that's next.
Talking too much.
How do I stop coughing on the air?
Well, I'm talking too much. Yeah, and we had to scramble a lot in the first hour because Matthew didn't show up, so we had to do a lot of scrambling.
Oh.
So anyway, no. First off, I'd use NutriSilver before you do the surgery and afterwards. So you want to prepare yourself for a day or two before you do the surgery and then after. Mm-hmm. And you want to use NutriSilver because it likes to penetrate around the gums very nicely.
Right.
Yeah, and I would do it 4 times a day, probably one spray per 10 pounds body weight 4 times a day, and that should keep your gums and so on and keep you nice. And then if you're trying to heal the gums afterward, CoQ10 ubiquinol and the Gastro Heal tablets, you chew on that. The combination will speed the healing. Okay.
I'm not reading. See how long that is? I'm going right to the chase. Cut to the chase.
Yeah, good, because lots of people are wordy.
Yeah, I enjoy that. It's just that I'm trying to get through these today.
Yeah.
Wesley, in an email, Bill, basically he's saying that he's diagnosed with MS 12 years ago after having hay fever, eczema, and learning disabilities in his youth. He didn't graduate high school because of, what's that, and fatigue.
Nystagmus basically means his eyes were having trouble with not tracking properly. That's probably related to the MS.
Oh, okay. Is that right? Okay.
Yeah. By the way, MS is triggered off by a spirochete, Lyme, babesiosis, or ehrlichiosis. And I have a protocol. I have a young gentleman I was Skyping when I was up in the middle of the night last night. He's in China. Mm-hmm. And I was able to turn his MS off, and we used a combination of our ketogenic diet and our malignant arrest, etc. protocol. And now he's on the peptides, and he's getting regeneration.
Special order peptides.
Yeah,
anyone that's interested.
And he's getting regeneration of his central nervous system with our nutraceuticals, mm-hmm. which you need both, and the peptides. And he previously was on our protocol for turning off his MS. And you don't need disease-modifying drugs like, for example, Copaxone and the other garbage. These drugs will actually screw up your immune system and make you get weird infections.
Mm-hmm. Robert from Oroville, California. Can you help people get off of toxic medications like antidepressants and mood stabilizers?
Absolutely, yeah. We start off with Combine Brain Mag, then things like Minerals Plus, and we can give you all kinds of nutraceuticals that will help you get off the toxic garbage. Because remember, we're correcting the underlying problem rather than just trying to medicate you. And we don't believe in using drugs for depression and other illnesses. You'd use nutraceutical and metabolic support.
Shingles, John, for shingles, what would you recommend for shingles?
Well, we have 3 antipathogenics, NutriSilver, Nutriodine, Allicin Med. You can use all 3. We also want to repair the nerves, which is Neurogen, and Sphingolin, which is myelin basic protein. and turn off the free radicals with gamma E+, cell detox glutathione, and that will actually turn off the inflammatory changes, and cell defense plus to stop the cytokines in the tissue. And so you can turn off that, and you can turn off the pain topically with topical pregnenolone and curcumin cream.
Next one's a political question. I'm sure you've done lots of those on the show. You don't want to get into that, do you?
No. Well, yeah, it depends on if it's against Trump, I'll take him apart. And I'll do what's called intellectual
It's our dear friend Lawrence from Chile.
Oh, yeah.
Talking about something about she's disqualified from
holding office, yeah. Well, that's obvious. Okay, so we don't need to get into that.
I think he went to Cornell Law or something.
Yeah.
Anyway.
Yeah, she shouldn't even be able to run. It's an obscenity. It's embarrassing to have someone as evil, corrupt, and just plain, she shows signs of early dementia, too, which is Parkinson's dementia, and there's no way this person should be allowed to run. She needs to run for a senior's home, and she needs to run for prison.
Bill. Neil from, he doesn't say, in an email, he's a long-time listener and a customer. He says, ever since airing on RBN, your sound quality's off. He thinks the treble is too high.
No, everything's been fixed. That's been fixed. Yeah, that's an old thing. Yeah, it's all fixed.
Well, it was dated October 18th, his email.
He's wrong. We've checked with our board ops. We got perfect sound now, and I checked the audio quality myself, and it's perfectly fine.
And we already
so you might be having some playback issues, but we have people all over the world, and we did have some issues with me recording when I was trying to get my software going for our videos, which were over on our Elgato chip, and that's fixed too. So, and now we're moving up to the live stream, our new Black Magic chip, and the audio software with the studio, and that's going to be available by next week. So
here's another question.
We have good quality sound now.
Sorry, worried about the vinpocetine. Have you heard any more about that?
No, nothing more.
Vinpocetine, if that's going to happen?
If they do it, I will, along with other people, sue them.
Yeah.
We'll sue the FDA. And by the way, they can't stop us as doctors. One thing that people need to understand, since 1928, when they set up the FDA, they have no authority over us as doctors. So
now, I'll
have the doctor form of it available.
What you might want to spend a minute or so on is the Cognition Plus, and that has the vinpocetine.
So does the brain power at higher doses.
So does the brain power.
And so does the synaptin.
What does it do, and why is it so important? Like, I take my Cognition Plus.
It's a neurotic drug.
I forget it, though. When I forget it, I think I can feel it after a few days. I'm not kidding. I've talked to other people that say when they forget to take their Cognition Plus for 3 or 4 days, they are more foggy-headed.
It opens up the neurotransmitter levels in your brain. It protects against oxidative stress.
It opens it up, actually.
Yeah, it improves your neurotransmitter levels, protects your brain from oxidative stress, right? Along with
which one? What are you talking about? The Cognition Plus?
Both. The brain
what's
power.
What's the difference between the Cognition Plus and
the brain power?
Is
a much higher dosage of the vinpocetine just by itself. The Cognition Plus has other components.
Less. The brain power is about half the price of
That's
the
because it's just
Plus.
straight vinpocetine. The Cognition Plus has a whole lot of other things in it besides the vinpocetine.
Okay, what's in it, and why is it? It's a big question for people. They want to know why am I taking Cognition Plus? Should I just be taking the brain power? What conditions would the Cognition Plus be recommended?
Living on planet Earth and your brain going before your body does. Living with the oxidative stress of scalar radiation from cell phones, Wi-Fi networks and smart meters, radiation and toxic foods, etc. Most people are going to lose their vision in their brain long before they die. And so the rate of Alzheimer's disease and neurofibrillary tangles is going orbital. In younger people, we get ADD, ADHD, and other diseases that we call oxidative stress disorders. I call BOF, or brain on fire. And there's an upregulation of microglial cells in the brain and increased peroxynitrate and hydroperoxy radical, which is why I also recommend things like gamma A+, CoQ10 ubiquinol, which crosses the blood-brain barrier.
But the Cognition Plus is more protection than is just straight vinpocetine.
No, vinpocetine is straight protection. The Cognition Plus is neurotransmitter support, as well as many other factors that are present. Do you want me to go?
Because I've heard you recommend the Cognition Plus for ADD or ADHD.
Both. I recommend both. The neurotics.
What if you don't have that and you're taking it?
You're going to get some, but you're going to get a lot more if you just take the brain power on top of it. For oxidative stress, which is very high. People have ADD, ADHD, Asperger's syndrome, pre-dementia, post-radiation syndrome, post-chemo brain. Their brain's on fire. In fact, a lot of women who actually die 5 to 10 years after breast cancer, they die of either heart failure or dementia.
Oh.
Yeah, because by the brain on fire after the chemo agents damage their tissue and cause mitochondrial dropout and later stages of oxidative stress to the brain tissue as well as the heart.
Another question from Lawrence from Chile, and that is the one. He says, a friend sent me this email, I'm using LED lights. I've heard that full spectrum lighting is the best. Please comment on Friday your opinion on the best lighting use.
Well, just for your room, the best lighting for your eye during the day is full spectrum light because it contains more blue light, which wakes you up. But you don't want blue light an hour before you go to sleep. Blue lights, even in the television, will wake up parts of your brain, shuts off your melatonin production in your brain. So that's why you want to turn your TV off and read. If you have blue light, it turns on the part of the brain that shuts off your melatonin production.
Blue light. Now, in my MacBook, on my laptop,
yeah,
I have that in bed.
You can switch it to non-blue
I'm reading
light.
Late at night. Christopher did something to my lighting so that it's gentle, it's easy on your eyes.
It takes the blue light out of the spectrum of the icons on your computer screen, because blue light will keep you awake.
So did you do that to your screen? Because
No.
you're often up in the middle of the night.
No, I didn't do it yet. But if you can, I don't know how to change it.
Get Chris to do it.
Yeah, but basically for melatonin support, you want to take the Minerals Plus, right? You want to take melatonin time release, and of course the combination combined brain make, because you have to prep yourself. And every 180 minutes, the brain cycles and has a little pulse of melatonin. So if you find you're sleepy at 3 o'clock in the afternoon, you go so many 3-hour time periods after that, 6, 9 o'clock is bedtime. If you fight it, your next bedtime is midnight. So the problem is if you go to bed too late, you're going to get less hours of sleep. And it's always best to turn off the lights and not be exposed to blue light an hour before you go to sleep.
Yeah.
Otherwise, your brain is going to miss the window. And I usually recommend an hour before sleep you take an extra combined brain mag and a melatonin time release 1 to 3.
Heather from Alaska.
Insomnia is a really big problem in our culture now.
Sorry. I know I'm going too fast now, right?
Go ahead.
Heather from Alaska for the best mineral supplement. That's a Minerals Plus.
Vitamineral, no, you need both because you get all the trace minerals and Vitamineral Max. You get specific extra ones for diabetes, neurotransmitter conversion, and antioxidant and tissue production of the RNA and DNA and Minerals Plus and neurotransmitters. So they're like specialized for the Minerals Plus, but the Vitamineral Max is your core, and the Minerals Plus is for the extra for these other areas. Need both. At least one each in the morning of each one, or the drinks. Life support.
Yeah, take the life support and you get everything.
Yeah.
You must be asleep over there.
Yeah, you must, yeah. It should be shut off earlier. 888-212-8871 if you want to call in and have your question. Best to email, and just email to the contact us at NutriMedical.com, and I'll answer your question, give you a recommended protocol, and then if we do follow-up, say in 2 to 4 weeks, and see how you're doing. If you have a full consult, it means we need to review medical records. I'll decide that based on whether we're making progress or how complex your problems are. Most of the time, it's just simply a matter of free. This is part of our ministry. You'll get an email, and I'll say, this is what you take for whatever health condition you have. And I'll tell you what kind of benchmarks of testing, both conventional and advanced testing, to be able to make sure we're making progress.
Carl from Illinois, Crohn's disease. Bill, I'm not going to read all that. Basically, Crohn's, that's a big thing, isn't it?
Well, there's 3 things you do. You kill off the pathogens with our living
Crohn's is very painful.
Living Probiotic Ultra, berberstatin. Number 2, you get rid of the autoimmunity with malignant arrest and our protocol for autoimmune disease. And number 3, we get rid of the leaky gut syndrome with GastroHeal and Immunomax, immunoglobulins, etc. So it's pretty straightforward to treat it. I don't use disease-modifying drugs. I don't recommend medications at all. Antipathogenics. It's due to a cross-reaction to Saccharomyces cerevisiae, which is a fungus it's used for making bread. And there's a cross-reaction between proteins in the basement membrane of the terminal small bowel and the Saccharomyces cerevisiae yeast. And that's the reason why they develop what's called immune homology, whereas a section of amino acids are identical. And the immune system goes crazy and attacks your bowel wall and the splenic or basic membrane. That's why you end up with ulcerative colitis.
I know we're pressed for time. How about for Charlie from Montana? Hemorrhoids. He's got other problems here.
Vein away.
We've already done prostate, haven't we, last week?
Vein away and the colon cleanse, which will soften your stools, and so on. The combination of the vein away, 2 capsules twice a day, and the colon cleanse, and then you want to use soluble fiber in your diet, like oat bran fiber. And the fiber that, by the way, is in our drinks, which is like the Aegis Life Support, is going to be very helpful and will make your bowels nice and smooth. And of course, the things like our colon cleanse is very, very good for cleaning out the lower bowel. It'll soften your stools and cause normal peristalsis and clear out the diverticuli. And the GastroHeal will heal the gut wall inflammation, and the Venuae will stop the varicosities above the dentate line called the white ligament at the base of the rectum, where you end up with the veins clotting off and causing hemorrhoids. So the Venuae is very helpful to prevent hemorrhoid progression.
Here's a question from Nicole from Ohio. She basically, Bill's I'm not going to read all that, but she flosses and brushes her teeth. She wonders if she can use toothpaste with fluoride in it if she spits it out and doesn't swallow it.
No, never. Don't ever leave it within yards of your body. It's so damn toxic.
Because you'd absorb it in your mouth,
and it
too?
blocks your thyroid. It's really toxic. It's a genotoxin, chemotoxin. Use Jason toothpaste with erythritol that helps get rid of nanobacteria. Brush your teeth with a Sonicare toothbrush. Use the NutriSilver after you brush your teeth. Rinse your mouth and hold it. Have basically what's called a hydrofloss device and put Nutridyne in it. Never ever use fluoride. Use Jason toothpaste.
And Jason, you can just get that on Amazon.
Yeah.
If you want to.
Yeah. Never use fluoride. Bad idea.
Well, here we are, Bill, at the end. You're here for the end, but